Have you ever wondered how IV cannulation is done step by step? Intravenous cannulation, a vital skill in the medical field, may seem daunting at first, but with a clear understanding and regular practice, it becomes second nature. The first step in this procedure is the selection of the most appropriate vein. The veins in the forearm, specifically the median cubital, cephalic, and basilic veins, are commonly used. A vein that feels soft, bouncy, and refill quickly when depressed is the ideal choice. Next comes the preparation of equipment. This includes a cannula, a tourniquet, an alcohol swab, a pair of gloves, and a dressing. It's also essential to have an emergency kit nearby in case of any unexpected complications. Once the equipment is all set, the healthcare provider must wash their hands thoroughly and put on the gloves. The tourniquet then is placed about 4 to 6 inches above the chosen puncture site. This helps to distend the veins, making them easier to visualize and puncture. The site is then cleaned using the alcohol swab in an outward spiral from the point of insertion. The cannula is then uncapped, and the needle is held at a 30 to 45 degree angle to the skin. The needle is inserted into the vein with a quick thrust. Once blood is seen in the cannula's flashback chamber, the angle of the needle is lowered, and it is advanced a little further into the vein. The tourniquet is then released and the cannula is further advanced into the vein, leaving the needle behind. The needle is then disposed of in a sharps container. Once the cannula is securely in place, a dressing is applied to the site to keep it clean and secure. Finally, the cannula is flushed with saline to ensure it's patent and not occluding blood flow. In summary, IV cannulation involves the selection of an appropriate vein, preparing the equipment, applying a tourniquet, cleaning the site, inserting the cannula, securing it, and finally flushing it. This process is crucial in the medical field. It allows healthcare providers to administer medications, fluids, and even blood products directly into a patient's bloodstream. It can also be used to draw blood for diagnostic tests. Understanding this process not only demystifies what may seem like a complex procedure, but also highlights the importance of precision and care in healthcare. The ability to perform IV cannulation effectively and safely is a testament to the skill and expertise of healthcare professionals. Remember, practice makes perfect. The more you perform IV cannulation, the more comfortable and proficient you will become. So, keep honing this essential skill, and you will be well equipped to provide the best possible care for your patients.